Hello everyone, I'm Anisohana binti Abdul Rahman. So in this video, me and my partner, which is Nur Aina Shahira Sakinah, will share with you guys about autism spectrum disorder. So do watch this video until the end, okay? So let's get started.
So, what is autism spectrum disorder, or can be known as ASD? ASD is a complex developmental condition that involves persistent challenges in social interaction, speech, and non-verbal communication, and restricted or repetitive behaviors. The effects of ASD and the severity of symptoms are different in each person. Because autism is a spectrum disorder, each person with autism has a distinct set of strengths and challenges. The way in which people with autism learn, think, and problem solve can range from highly skilled to severely challenged. Signs of autism can be divided into three forms. The first one is social skills. A child with ASD has a hard time interacting with others. For example, they don't respond to their name by their first birthday. Secondly, they prefer to be alone. Next, they avoid or reject any physical contact. When they are upset, they don't like to be comforted. And the last one, playing, sharing, or talking with other people don't interest them. Secondly, in terms of communication, most have problems with communication, including this: delayed speech and language skills. Secondly, echolalia, which is repeating the same phrase over and over. Next, problems with pronouns, such as saying you instead of I. And then, not using common gestures, such as pointing or waving. And the last one is inability to stay on topic when they are talking or answering questions. And the last one is patterns of behavior. For instance, repetitive behaviors like hand flapping, rocking, jumping, or twirling. Besides, they do specific routines and getting upset when a routine is changed even slightly. Their lack of coordination and clumsiness. Next, they have aggressive behavior, both with self and others. And the last one, they can be extreme sensitivity to touch, light, and sound. Okay, so what is the causes of autism? Actually, until now, we still don't know the exact cause. However, research suggests it's a combination of developmental, genetic, and environmental factors. So, the first one is genetic. Several different genes appear to be involved in autism spectrum disorder. For some children, autism can be associated with a genetic disorder such as Rett syndrome or Fragile X syndrome. For other children, genetic changes, which is mutations, may increase the risk of autism. Some genetic mutations seem to be inherited, while others occur spontaneously. Next, having an immediate family member with autism. If a parent carries one or more of these gene changes, they may get passed to a child, even if the parent does not have autism. The other causes is environment. Sex hormones, medications, and certain metals such as lead, pesticide, and chemicals used to make plastic hard have been long suspected of having a role in autism. Many studies have shown that chemical exposure during development of embryo can have much more serious health effects than the same exposure would in adults. A large 2014 study investigated the connections between autism and genital malformation. These malformations happen whose mothers have high levels of chemicals that affect the hormones in their bodies. Boys with autism more likely to be born with genital malformations. And the last one is pregnancy and birth. Pregnancy and to a lesser extent, early infancy appear to be crucial periods when brain development may be affected. Bacteria or viral infections in the mother during pregnancy have been found to slightly increase the risk of autism. However, this is only a minor factor. Other factors in the mother that could be related to offspring autism include a folic acid deficiency, gestational diabetes, and the use of certain antidepressants during pregnancy. Conversely, taking prenatal vitamins seem to decrease the risk.
Read the word autism. He asked me, is there something wrong with me? I have nothing wrong, he says.
Based on previous video, there is a theory involved, which is Erikson Lifespan Development Theory, which is on stage 5, Identity versus Role Confusion, involves adolescent. Identity means how a person sees themselves in relation to their world. It's a sense of self or individually in the context of life and what lies around. Role confusion is an absence of identity. Chester Sims, which is an autistic in that video, in his early autism process, he cannot see clearly at all who he is and how he can relate positively with his environment.
As the boys grew older, their behaviour became more destructive.
They wrecked everything, soiled everywhere, threw up everywhere, threw food, smeared food, everything that could be broken.
Based on previous video, theory involved is Vygotsky theory. Language is the basis of Vygotsky ideas on social interaction. The twins continue to interpret meaning from the reaction of others, especially their parents, further integrating the cultural beliefs into their own cognitive development. Without understandable language, the twins cannot interpret the real situation and lead to aggressive behavior.
Yes, Anna must be a Honda Fit. Must be Honda Jazz.
Oh, okay.
Anna must be a Honda
I tell
Jazz.
you what, why don't after this we take a bath?
Now, I'm gonna talk about my documentary, which is about Tuani. Tuani is also diagnosed with autism at the age of 3. He was recognized by his parent when he's not be able to give a speech. However, as for his development, as he grows older, he tends to be more independent of himself. He can feel that he wants to do what he can do. This is because the supportive of their parent that led him to become more independent. He's able to think maturely as he's getting older. It shows that Tuani wants to lessen their parents' burden. For instance, he can go out on his own to attend his class without their parent accompanying. Meanwhile, he has his capability to manage his own self. Although he is a non-speech person, Tuani is able to think, to feel, to see, to understand what happens around him. Furthermore, just like the normal person, he has his own self-interest, such as he loves to play puzzles, he loves to do many kinds of activities such as gardening, housework like tidying up the house, hanging the clothes. This development is so related with Vygotsky theory. According to Vygotsky theory, he believed that cognitive performance is influenced by the cultural context in which children live. This can be seen by the fact that Tuani's family supports it in many respects. From my point of view about the journey of Tuani, who was diagnosed with autism, he had faced a lot of challenges. Due to his symptoms of behavior, people tend to view him differently and keep calling him crazy. In this matter, I totally disagree and disappointed for those people because they have to treat them as a normal person like us and respect them whoever they are. As for his parents, they also faced the challenges. There were a few times, out of sudden, Tuani showed his extreme behavior which was difficult for them to handle the situation. However, as being his parent, they want to do the best for Tuani as they could. But attending the treatment frequently, Tuani, who at the age of 40 have shown his other skills that can he explore. In other words, he has changed himself, which is different from his past in terms of cognitive development.
There are similarities between the individuals in those videos. The first one is social interaction and communication problems. They have difficulties sharing emotion and sharing interests. Besides, they have issues with non-verbal communication, such as trouble maintaining eye contact or reading body language. Secondly, They have restricted and repetitive patterns of behaviors, interests, or activities. For example, repetitive movements, motions, or speech patterns. They also have negative reaction to a specific sound. Besides, they face some challenges such as mood instability and meltdowns. For parents, they have guilty feelings, which is wrongly blame themselves for the disorder, especially when they lost temper or when they feel that they are not doing things right. And the last one, all the individuals have undergo autism therapy that could improve and develop new behaviors, from better social skills to increased intellectual abilities.
Next, for another similarities, they had faced the same challenges in which they were surrounded with people that treated them differently from the normal person. People tend to look down weirdly and may label them as they had a health mental issue. From my point of view regarding to this situation, we cannot judge people easily, and whoever they are, we have to respect them with manners. Other than that, their parents also face the same challenges in handling their children at the hardest situation, which their children all of a sudden begin to act aggressively and extremely. This situation may break their mental down, which is not good for their health. Meanwhile, the main support system is their parent. And no matter what happens, their parents show that they are willing to do anything to make the best for their children as long as they're happy. The parents show that they already accepted the destiny of their children, and even the children is having an autism, they tend to be a responsible parents towards their children. I think this is the best decision they have made. Rather than being neglectful parents, why don't we take care of them and give love to them? Because all the children need is support, care, and love. According to Diana Baumrich's parenting style, their parents implement an authoritative parenting style. In this parenting style, their parents is nurturing and supportive. Next, all of them had went for the treatment. By following the treatment, they tend to show their improvement slowly. Next, we are going to discuss the differences between these three individuals. Firstly, there are a few differences between them in terms of development of cognitive. From my point of view, they'll be able to show the improvement of their behavior and attitude as they get older, but in a different aspect. For Duane, at the age of 40, he was able to say maturely, such as he tends to do the house chores himself without any instructions from his parents. However, until now, he still not be able to give a speech. Due to this, he cannot afford to have a communication verbally with the society. However, this situation is contrast to Chester, who also diagnosed with autism at the age of 3. At first, he's also not be able to speak. However, as he gets older, which at the age of 17, he was able to speak. Regarding to his past, he was confused on how to interact or communicate with people. But now, after he get the treatment along with the new guidance, he able to learn in interacting with people socially. Since he able to speak, many people think he's just a normal person. On the other hand, he successfully moved toward his future dream. Meanwhile, the autistic twins Samuel and Jacob, they also improved in terms of their development of cognitive. At first, they were emotionless, expressionless, and less responsive. However, as they get older and being treated, they'll be able to change. They're able to follow the instructions, they're able to control their calmness, and they had desire to communicate. Based on the documentaries, in generally, most of them went for cognitive behavioral treatment for seeking the improvement regarding to their current ability. As we can see, the treatment and the guidance they follow have helped them in many respects. However, there are no cures for autism, but therapies and other treatment considerations can help people feel better or alleviate their symptoms. Based on my opinion, there are many other treatment approaches involve therapy such as behavioral therapy. It can help to develop of their regular routine, and it usually comes from structured class training. Second is occupational therapy. Occupational therapy is teacher skills that help the person live as independently as possible. Skills may include dressing, eating, bathing, and relating to people. The third one is speech therapy. Speech therapy helps to improve the person's communication skill. Some people are able to learn verbal communication skill. For others, using gestures or picture boards is more realistic. And the last one is social skills training. Social skills training teaches children the skills that need to interact with others, including the conversation and problem-solving skills. In addition, massages, weighted blankets, and clothing and meditation techniques may also induce relaxing effects. However, treatment results will vary. Therefore, as a conclusion regarding to these 3 documentaries, these amazing people that mentioned in our discussion earlier who were diagnosed with autism had shown their great progression and cognitive development in their journey in many aspects. For overall, with the supportive, encouragement, caring, and loving from their parents, they'll be able to move forward to be more independent and successful person. Meanwhile, there are a few theories that we have learned that can be related to these documentaries. Rather than we forcing him to change himself, we have to give our love and try to understand about their world. We have to know and we have to remember all they want is to be accepted by people in the world. Autism isn't a choice. Acceptance is.